In the early 1940s, researchers were observing the really devastating effects of nitrogen mustard gas, a chemical weapon from World War II.
Right. Highly toxic stuff.
Yeah, exactly. And they saw what it was doing to soldiers' white blood cells. But that dark, horrific observation, it didn't just change modern warfare, it actually accidentally birthed an entirely new medical field.
Which is just wild to think about.
It really is. Oncology came from that. And welcome to today's deep dive because, when you walk into a hospital or you look at a referral sheet, you are immediately thrown into this sea of intimidating puff-serologists and elotologies.
Oh, yeah. It's completely overwhelming.
It is. It can feel less like a place of healing and more like, I don't know, like you're trying to decipher ancient Greek just to figure out who is supposed to look at your lab results.
Yeah, you don't know who the doctor is.
Right. So our mission today is to decode this language for you. We're going to pull apart this matched pair of suffixes. So elotology for the field of study and elotologist for the practitioner.
And we've got some fascinating historical accounts and etymology breakdowns to look at today.
We do. We're going to uncover the completely surprising history of how medical fields actually get their names and, give you the tools to navigate modern healthcare without feeling so lost in the jargon.
Because once you understand the mechanics of these words, they really stop acting as barriers. They become a map.
A map of how the knowledge is organized, right?
Exactly. The jargon is actually a highly logical construction kit, but you just have to know how the pieces fit together.
Okay, let's unpack this. If we treat medical terminology like a modular code or Lego kit, you essentially have a root word, an optional combining vowel, and a suffix.
Right, so the root names the body part.
Like cardi for heart or nephr for kidney. And the suffix names the field. But there is a very pedantic linguistic truth from our sources about how this code is written, specifically regarding that middle piece, the famous O.
Yeah, this is where it gets highly technical, but it's fun. Technically speaking, in the original Greek, the suffix is just logia.
Just the logia.
No, O.
Right.
O. The O isn't actually part of the suffix at all. It is literally just a combining vowel meant to smooth out the pronunciation.
Wait, what?
Yeah, when you're connecting a root word that ends in a consonant to a suffix that starts with a consonant, you need the vowel, like cardi plus O plus...
Wait, so ology isn't really the suffix? My whole life is a lie.
I know.
I mean, why do dictionaries and textbooks let us get away with saying homology then? Are we just collectively using bad ancient Greek syntax because it's easier to say?
Basically, yeah. It's an accident of human anatomy and language colliding. In medicine, nearly every Greek or Latin root describing the physical body ends in a consonant.
Oh, I see.
Right. So when you build the word, you almost never have a medical root ending in a vowel. Because of that, that O appears so universally that society just, we effectively adopted ology as the atomic suffix.
Even though linguists know the technical truth.
Exactly. Linguists know it's built as cardi/O/olology, not cardi/erlology. But for everyday life, it's just a structural patch that became permanent.
A pronunciation lubricant that accidentally became the entire identity of the word. That's hilarious.
Yeah, and if you're building a word with a root that already ends in a vowel, which is rare in medicine but common elsewhere, like biblio for book, you don't add the extra O.
Oh, right. You don't say bibliology.
Oh, exactly. But for the human body, the O is pretty much ubiquitous.
Okay, so we know how the word is physically snapped together, but historically, looking at the sources, there is this massive gap in how these words were actually used.
It's a huge gap, yeah.
Because the root is the ancient Greek word logos, meaning word, speech, reason, or discourse, right?
Correct. So alogia basically meant a discourse concerning a subject.
And Plato actually used the word theology, meaning discourse about the gods in the Republic, around 380 BCE.
That's right. The suffix existed in antiquity.
But then it just stops. I mean, it took roughly 2,400 years for modern medical ologies to actually appear.
It's a staggering amount of time.
It really is. People were studying the human body for thousands of years. So why didn't someone in 1200 AD decide to call their work cardiology? Why did we wait until the Enlightenment for this explosion of naming?
Well, if we connect this to the bigger picture, for thousands of years, the study of the body wasn't separated into distinct, rigorous lanes.
Right, you just had general doctors.
Exactly. You had general physicians, apothecaries, surgeons, philosophers.
Mm-hmm.
But the Enlightenment fundamentally changed how we organize human knowledge.
Mm-hmm.
Before the 18th and 19th centuries, you had these really broad, vague categories, like natural history.
Which could mean almost anything.
Yeah. But as tools like the microscope and early chemistry improved, human knowledge just became too vast for any one person to master. The scientific community was basically forced to subdivide.
They needed a new filing system.
Precisely. And the watershed moment was the birth of the word biology in 1802. It was coined independently by two naturalists, Dreviranus and Lamarck.
Okay, so that was the anchor point.
Yeah, that signaled that metallurgy was now the default naming convention for any newly organized systematic science, and medicine followed right alongside it.
Right, because I saw dermatology emerge as an organized clinical field around 1801 with Jean-Louis Alibert in Paris.
Yes, he established a dedicated skin disease service.
But did a doctor like Alibert just sit down at a table and declare, I am now a dermatologist? It feels like you need the knowledge first before you get the title.
You do. You absolutely do. The names only crystallize after the knowledge became coherent and institutionally organized.
Okay, that makes sense.
Take pathology. For centuries, pathology was just a loose, descriptive term for suffering. But in 1858, the German physician Rudolf Virchow published Cellular Pathology.
And he proved that disease originates at the microscopic level of the cell.
Exactly. He took pathos, meaning suffering, and logos, meaning study, and completely reoriented the discipline. He didn't just invent a word. He defined a new boundary of scientific rigor.
And that concept of boundaries is crucial. Here's where it gets really interesting, because many of these iologists wouldn't even exist without wildly specific technological breakthroughs.
Oh, absolutely. The tool often dictates the title.
We're talking about machines and gadgets literally making new types of doctors.
Consider radiology. In November 1895, Wilhelm Röntgen was experimenting with cathode ray tubes in his physics lab in Germany. And completely by accident, he discovers X-rays.
Right.
Within weeks, he produces the first ever X-ray image of a human body part. It was his wife's hand, where you can clearly see the bones and her wedding ring.
It is an incredible, haunting image. It completely shattered the way we view the human body, because before that, the only way to see a living skeleton was, well, surgery.
Right, you had to cut someone open. And the medical impact was instantaneous. Within a single decade of that photograph, hospitals worldwide had established dedicated radiology departments.
A decade. That is lightning fast.
It was an incredibly fast transition from a novel observation in a physics lab to a fully named medical specialty. And it happened because the equipment, the X-ray machine, required a completely new set of skills to operate and interpret.
And we see that exact same mechanism with cardiology. I mean, the word existed, but it only became a real specialty after Willem Einthoven built a practical electrocardiograph.
The ECG, around 1901 to 1903.
Right.
Think about the paradigm shift there. Before the ECG, how did a doctor study the heart?
They just listened to it with a stethoscope.
Exactly. It was entirely subjective. The physician heard a murmur and made an educated guess.
But the ECG gave them objective, measurable electrical data. It printed out a voltage graph.
Right. Suddenly you weren't just listening to a chest. You were interpreting complex electrophysiology. The machine demanded advanced physics and mathematical interpretation.
The tool forced the creation of a specialist.
It really did. And we see this with endocrinology, too. The entire field relies on the concept that organs release chemical messengers into the bloodstream.
But that was just an unproven theory until 1902.
Yes. The famous experiment by Bayliss and Starling, they proved that a substance from the small intestine, which they named secretin, could travel through the blood and trigger the pancreas to secrete digestive juices.
Proving chemical signaling at a distance.
Exactly. The word hormone was coined shortly after, and by 1909 the field was officially named endocrinology by Nicola Pende. The chemical proof birthed the etology.
Wow. Which brings us back to oncology and the story of nitrogen mustard gas from the hook. It's fascinating because modern chemotherapy didn't start in a pristine medical lab. It started with a weapon of war.
Yeah, observers noted that soldiers exposed to the gas had severely suppressed white blood cells.
And so in the early 1940s, pharmacologists realized that if this chemical destroyed rapidly dividing white blood cells in healthy soldiers, it might also destroy rapidly dividing cancer cells.
Right, they used that dark observation to treat lymphoma.
A chemical warfare agent becomes the foundation for systemic cancer treatment. I was blown away to learn that because they suddenly had a treatment affecting the whole body, rather than just surgically removing a tumor, oncology actually became a viable clinical practice.
It's a relatively young field.
Very young. The major professional body, ASCO, wasn't founded until 1964. The institutional specialty of oncology is younger than color television.
It really puts the timeline of modern medicine into sharp perspective. The astrology suffix is a relatively recent badge of honor. It's reserved for fields that have achieved a high level of empirical technological validation.
But if this suffix was the ultimate stamp of Enlightenment legitimacy, if it signaled that a field was rigorous and backed by tools, how long did it take for people to realize they could just fake it? Does slapping an ethology on a word automatically make it a legitimate science?
This raises an important question, because the answer is no, it doesn't. And it didn't take long at all for people to hijack it. In the 19th century, attaching ageology to a subject became a deliberate rhetorical strategy.
A way of borrowing the prestige of science without actually doing the scientific work.
Exactly. The suffix simply means a systematic body of claims. It does not guarantee that those claims are based in reality or verifiable evidence.
It's linguistic camouflage. You dress up in the vocabulary of a scientist to bypass critical scrutiny.
And this prestige was hijacked by numerous pseudosciences: astrology, numerology, graphology. But historically, the texts point out the most prominent and damaging examples were phrenology and craniology.
Right. Phrenology was Franz Joseph Gall in the early 1800s. He claimed you could map a person's character and intelligence by measuring the bumps on their skull.
A concept we now know is entirely baseless.
But they didn't just write a pamphlet about it. They built an entire ecosystem that mimicked real science.
That's how they manufactured the appearance of rigor. They used the ology suffix. They created systematic anatomical charts, founded professional societies, published peer-reviewed journals.
They even had specialized calipers for measuring the skull.
Right. It rested on zero verifiable evidence. But because it possessed the apparatus of the scientific method, segments of the educated public took it very seriously.
And craniology took that manufactured rigor to an even darker place. The sources are very clear about this. In the 19th century, figures like Samuel Morton used detailed skull measurements to rank human populations.
Yes, creating a hierarchical classification of races.
Which was an active pseudoscience used to provide intellectual and biological cover for systemic racism and slavery. Morton used the prestige of the ontology to validate deeply prejudiced ideologies, all under the guise of objective measurement.
It is a stark historical reminder. A naming convention can be manipulated, and heterology is not an inherent certification of truth. It is merely a signal that a system of thought has been organized.
And we still see this hijacking today, just, in consumer marketing. Oh, all the time.
You turn on the TV and see self-styled sleepologists or skinologists selling supplements. They are trading on that exact same 19th century rhetorical move to sound official. They borrow the lab coat without doing the lab work.
It's highly effective marketing because we are culturally conditioned to defer to that suffix. But, it's worth pointing out that even within legitimate modern medicine, these titles still cause major confusion.
And sometimes fierce professional turf wars.
Yeah, exactly.
Turf wars. You mean doctors fighting over the title itself?
Well, they fight over what the title allows them to do. Think about scope of practice boundaries in a modern hospital. Let's look at an interventional cardiologist. By their title, the idologist, they are fundamentally a diagnostician who studies the heart.
Right.
But today, because of advances in technology, an interventional cardiologist performs highly complex physical procedures. They thread catheters through arteries, they place stents, they close structural heart defects.
Which, mechanically speaking, is surgery. You are physically altering the anatomy of the patient. Exactly. But historically, altering the anatomy of the heart was the exclusive territory of the cardiothoracic surgeon. The doctor who, cracks the chest open.
Ah, I see where this is going.
Right. So as catheter technology improved, you started seeing real disputes in hospital credentialing committees. The surgeons argued that the audiologists were overstepping their bounds, performing surgical interventions without surgical titles.
And the cardiologists probably argued that the new tools fell under their domain of treating the heart's vessels.
Exactly. The traditional title no longer perfectly matches the evolving hands-on reality of the job.
So what does this all mean? Given all these confusing boundaries, the overlapping names, the borrowed prestige, the doctors doing procedures outside their historical titles, how do you actually navigate a hospital?
It's a great question.
When you are handed a referral sheet, how do you know who you are actually going to see?
To navigate the modern hospital, you really have to map out the neighboring terms and understand a fundamental split in medical philosophy. The biggest mistake patients make is confusing iadology, which is a discipline focused on studying and analyzing, with iatry, which is a discipline focused on healing and treating.
Iatry comes from the Greek iatros, meaning healer, right?
Correct. And the ultimate example of this, are arguably the most consequential mix-up in all of healthcare, is psychiatry versus psychology.
Oh, this is a massive aha moment for healthcare navigation.
It really is. They both share the root psyche, meaning mind or soul. But a psychiatrist uses the iatry suffix. They are a medical doctor, an MD or ADO. Their primary scope is to treat mental illness medically, often by prescribing medication to alter brain chemistry.
While a psychologist uses the iagology suffix, they study the mind and human behavior. They often hold a PhD or a CFID, not a medical degree, and their primary scope is talk therapy or cognitive behavioral interventions.
Exactly. Same root, entirely different suffix family, different training, and a completely different approach to the patient. Knowing that econometry signals a medical healer and echology signals a systematic studier instantly clarifies a huge portion of the directory.
And what about the other non-ecologists?
Well, you have echinodicians like pediatricians and clinicians, you have ecdists like dentists, and you have technical doers like a radiographer. The radiographer takes the x-ray while the radiologist reads it.
And this also explains why not all ecologists are medical doctors to begin with. Like biologists or geologists, the suffix just indicates mastery of a field of study, not necessarily a medical license.
Spot on. And when you look closely at how a hospital functions, the truest decologists are often the ones you never see.
Let's trace the assembly line of a cancer diagnosis from the text, because this is where understanding these roles becomes critical for a patient's peace of mind.
Yeah, let's walk through it.
So, a patient finds a lump and goes in for a biopsy. First, that tissue sample goes to the pathologist. The pathologist studies the cells under a microscope and makes the definitive diagnosis of cancer.
Right.
Then, the patient needs imaging to see if the disease has spread. The radiologist reads the MRI or CT, scans, and stages the disease.
Okay.
Finally, the oncologist takes all that analyzed data, designs the treatment plan, and directly manages the patient's care. 3 different oncologists, 3 totally distinct roles.
But notice the paradox hidden in that assembly line. The pathologist and the diagnostic radiologist are arguably the most central figures in diagnosing the disease. Without their analysis, the oncologist doesn't know what they are treating.
Yeah.
Yet the pathologist and the radiologist frequently never meet the patient face to face.
That is wild. The person who actually discovers the illness in your body, who makes the call that alters the course of your life, might be someone whose hand you never shake. They are the invisible doctors.
They are pure etiologists, in the most literal ancient Greek sense of the word. They are engaging in the logos, the systematic study and interpretation of data separated from the direct bedside treatment of the human being.
It fundamentally shifts how you view the medical ecosystem. I mean, we started this deep dive with an ancient Greek word used by Plato. We traveled through the Enlightenment, where scientists finally decided to neatly label the natural world.
We learned how a World War II chemical weapon accidentally birthed oncology.
Right. And we exposed how pseudosciences hijack the uniform to manufacture fake rigor. And finally, we built a practical survival guide for decoding hospital suffixes.
It really demonstrates that medical terminology isn't just arbitrary jargon. It is a living, breathing record of how our understanding of the body has evolved.
And how technology has forced us to create entirely new categories of experts. Which, brings up something from the text about AI-assisted image interpretation. It's causing real policy debates right now in radiology and pathology.
It's a huge topic.
And it makes me think, if AI eventually takes over the entire ology part, the systematic studying, the pattern matching, the pure data analysis, will human doctors in the future drop the algech's title altogether?
Oh, wow. That's a profound question. If the algorithm is doing the studying, what is the core function of the human physician?
Exactly. Will the next era of medicine see a return to titles focused entirely on the human connection, on the healing, the comforting, leaving the cold analytical algology to the algorithms? Makes you wonder. So, the next time you are sitting in a waiting room, looking at a medical bill or a referral sheet, feeling like you're staring at an undecipherable language, remember the modular code.
Break it down.
Find the root, spot the combining vowel, and identify the suffix. Suddenly, that intimidating medical jargon isn't so murky anymore.